But they have to look at everything that's available and then make the decision for themselves. And
Correct.
then, you know, you will make it available to know, well, okay, this will happen. And, you know, sometimes it doesn't happen to them with the side effects. It doesn't affect everyone.
Correct.
You know, so maybe they might be the lucky one.
Right.
You know, in that availability. So I just kind of wanted to touch a little bit. Is there anything else that maybe you want to touch on to add to our viewers?
Sure. The other thing that is also, I think, is important for people to understand, not only from an advertisement sort of standpoint, but other times people will have a friend or somebody say, oh, this worked really well for me. And as with a lot of products that are available, what works for one person doesn't necessarily work for another person, which is the reason that we have this myriad of products available, because not only will one product work maybe better for another person, but also sometimes people's bodies will get used to a certain product. They've used something for many years, and then all of a sudden it's not effective, and they can be quite disappointed by that. They don't know what to do. They think that maybe that's all they've had because they've tried so many things. So it's a good idea, if that is a person's case, to revisit the physician, their dermatologist, because a lot of times with the number of people that have problems with psoriasis, there's a lot of new research going on, and as I said, this past 5 years it's been seemingly almost an explosion in the number of treatment modalities that are available for a person.
And what a great way, come to you, and then all of a sudden, you know, your body owns up to its own immune system, you know, because of the treatment they had, and now you've got all these great new techniques out here, you know, to introduce them to. So that would be really great. Yeah.
Another point too, I believe, is good to make is some of those products, especially the systemic ones we were talking about, for some people that have the internal joint pain, that can be quite debilitating. It's great to have those new medicines because they are a lot less toxic to the person's overall health. They don't have to monitor the liver like we had to with certain medications that were more immunosuppressive agents, agents that suppressed your immune system to a greater degree, and they affect the liver or the kidneys and or the white blood count and red blood count. So it's nice if a person hasn't been back to find out what's available. There's a lot of new medications that are available that and or treatments such as the laser that some people have given up. They've decided that there's not anything new.
Right, they have to live with it, whereas that's not the case in the last 5 years. They need to go back and, you know, get this knowledge through Knowledge for Wellness, and then, you know, also go back to you and see what possibilities that you can create for them. You know.
Another area that I'd like to talk about is scalp, because some people, again, can be quite uncomfortable with having, you know, the flaking that can be quite visible. And so some of these treatments that we've talked about, the sprays, the injections, the light treatment, can be quite helpful for that area as well, which some people can be quite concerned about, and just justifiably so.
Sure, because we all seem to have to make an appearance, and, you know, we're all self-conscious, and then to have this, you know, showing, you almost feel like a leopard, you know, and this would really help them also with their own self-esteem.
Absolutely.
You know, to go to you and to make sure that they can get this kind of a little under control, at least to a comfort level too.
Exactly.
If you can. So.
Another aspect that I briefly touched on was nails. In psoriasis, you can get some pitting in the nails, some discoloration, and that can be a rather mild sort of manifestation of psoriasis. A more severe manifestation is where actually the nails will deteriorate.
Okay.
And so then you don't have that protective, functional nail plate for grabbing, for getting traumatized. So that can be quite uncomfortable, debilitating, let alone the disfigurement. Being able to not have a nail that looks normal, it looks a little unusual. And also when it can deteriorate like that with psoriasis, again, an infection can get into the nail a little bit more easily. And sometimes it is difficult to tell, is a nail that's disturbed peely, flaky. Is it psoriasis or is it fungus? And so sometimes you need to distinguish. Sometimes clinically it's very easy to do that, or sometimes a person needs to have a culture of the nail, taking it off and have it evaluated to see if there's something there other that can be dealt with as well.
Sure. I know that they just basically go underneath and take a little biopsy of it and a sample, and then they send it off to the lab.
Correct. It can be just as mild as scraping, so it doesn't even have to be cutting. It doesn't hurt.
Yeah, they're not going to go in and just whip off your whole nail and send it to the lab. So
absolutely.
Yeah, it's pretty limited on the technology that you can use with just a microscope piece of someone's, piece of their nail to find out exactly that. And I just want to talk a little bit maybe in regards to, is there any maybe sort of clothing that might soothe, that they can wear underneath?
Sometimes people will wear a suit, an exercise suit, and especially I think one of the better products to use on a person's skin is the heavier greasy ointment, because it seals the moisture in. And if you use an equivalent percent or concentration of a cream versus an ointment, the ointment is more effective.
Okay.
So if you apply that ointment to damp skin, such as right after a shower or bath, just a little dab, rub it in really well. That ointment will hydrate the skin, it'll keep the medicine in, and the medicine can penetrate better.
Okay.
So some people, if they have full body involvement, will choose to wear something like that will hold the medicine in place, that if they get a little bit of extra of the oily consistency of the medication on their skin and on their clothes, it's not a big deal. Plus it sometimes can hold the medicine in place a little bit better and force the medicine into their skin a little bit better.
Sure.
So they do make outerwear that can be used in that manner as well.
Okay. I was thinking the things that we wear for working out, the Under Armour type of products, things like that would probably benefit. We wear that during the summer. There's a good brand that we wear, during the winter months. It's supposed to keep us warm, keep close to our body, but yet let us sweat it out too.
Right.
That's kind of what I was thinking on that line.
Absolutely.
Yeah.
Anything like that. And sometimes people will just donate that to their skin, saying this is what I'm going to use for trying to get my skin looking and feeling better.
Yeah.
And a lot of times they'll do that initially for a period of time, and then they may not need to continue that. Many years ago, when I first started my dermatology residency, people would have to be hospitalized for a treatment of their psoriasis. That's how far we've come, being able to treat people not in a hospital setting. They'd have to go in for soaks and then having all these different medicines applied and ultraviolet light, and they had actual wards for psoriasis patients.
Wow.
And that's pretty much unheard of at this point because of the advances that have been made.
Yeah, to get to that point must be awfully painful back in the day. Wow.
Absolutely.
Yeah. And we've come so far with all of these new treatments. So that would be great.
And it's exciting with all the new options that are becoming available, because you feel so for these people that have the more significant problems, and it's great to be able to offer some of these different treatment modalities. And also they are so much more safe than they used to be. So it's great to be able to offer that.
Yeah. That's great. I know, and to just go ahead and make them live a little bit less pain-free.
Absolutely.
That's great. Well, as we've said before, we've run out of time.
Okay.
So I want to thank you again.
My pleasure.
For coming on.
That's great.
And I hope we have provided you more knowledge to benefit you and your loved ones. So until next time, be well and goodbye.